Together Youth Mental Health project started in January 2020 and ran until January 2021. The main features of this project were building a youth advisory group of parents and youth from newcomer populations. The key features of this program would definitely be engagement with youth and parents around newcomer mental health and wellness, as well as engaging with stakeholders and building partnerships with regards to service provision for mental health and wellness in the newcomer population in St. John's, Newfoundland. Some of the outcomes of the program were to build advocates, champions, and youth who really were leaders in the community with regards to encouraging other youth and families in the newcomer community to access mental health. There was a gap seen with regards to newcomers being able to navigate, understand, and access mental health services in St. John's. So this is why the project was started. Together Youth really began to basically break down those barriers and allow newcomers to understand how to access and where to access mental health services. The long-term goals are really to share information, connect with stakeholders in Eastern Health and in community partners, as well as education and information sharing. The Together Youth Mental Health Project had 10 members in the advisory group. Those 10 members were comprised of newcomer youth and parents. Some of the things that we looked for when recruiting for the advisory group membership were commitment to the program, understanding of mental health and wellness topics within the newcomer population, as well as the ability to feel confident and empowered to be able to talk about these very difficult subjects sometimes, as well as the strength and the resilience to be able to break down the barriers and some of the stigma in their own communities as newcomers. When the 10 members of the advisory group joined, the parents and the youth, essentially what we said was, let's build capacity, let's build knowledge, and then start sharing that knowledge. We also developed 3 modules. So there was a module for parents, there was a module for youth, and there was a module for service providers. Now, the modules for youth and parents were essentially, let's talk about newcomer youth mental health and wellness and all the concepts and how to access services. We really broke it down. But the advisory group were able to give their feedback and to share from their cultural context and their view and their lens. Would this work in the newcomer community? Would this be appropriate in the newcomer community?
I believe the key features that make this program effective are the fact that our community board members come from a very diverse background and they're among different age groups. And this in turn creates this perspective of different people from different nations and different cultures that make it really effective. There are things that are okay in certain cultures and it's definitely not okay in different cultures. So what we're trying to do is we try to bring all the perspectives together and compile it into a module that can be delivered to our service providers so they can understand and they can look through problems that newcomers face in general through their own lenses. For example, you as a committee board member would come in and we will, for example, have a discussion on how healthcare professionals interact with newcomers. And we would ask you open-ended questions into aspects of your interactions with healthcare professionals that you have felt does not work with your culture, for example. Like for a Middle Eastern culture, when a male doctor comes in and touches a female patient, it is taboo for a male to touch a female in Islamic perspective. So we try to bring these questions and then we try to get as much as information from the committee board member and then condense it and work with it and then create modules that we can then deliver to healthcare professionals or to schooling systems. Our program has a very broad outreach. We give virtual and in-person sessions delivering modules to service providers, Eastern Health, Choices for Youth, and we also have a very active social media. We are on Twitter, we are on Facebook and Instagram, and we convey our messages very clearly.
So one of the initiatives that we participated in and developed was a series of 5 podcasts that really featured 5 of the newcomer youth from a number of different countries. And that podcast really talked about the lived experiences and the project, as well a little bit of personal information about that particular newcomer youth and what they wanted to share around their thoughts and their feelings and their vision for youth mental health and wellness in the newcomer community. One of the partner organizations that approached us was Choices for Youth. Again, Choices for Youth serve youth in the St. John's community from all backgrounds. Basically, they were very interested in learning about mental health and wellness in the newcomer community because this is a population they're beginning to serve themselves. So they wanted to understand better how the project was running and basically what the services were and how to approach newcomer youth in a very culturally humble way.
You know, the first part of our work was really about making sure the project understood exactly what was needed locally. And so right from that point, newcomers were engaged. We did 3 focus groups with newcomer moms, newcomer dads, and young adult newcomers. And those were very dynamic and quite powerful at points, discussion sessions, and really focused in on the questions, you know, what do you think newcomers need to know and understand about mental health and wellness and accessing services? And as well, what do service providers need to know about newcomers here that would help them to provide more culturally relevant or effective interventions? And those were fabulous conversations. And they really gave us not just some good content to go into the sessions, but from an evaluation point of view, they were almost a sort of a benchmark that we as evaluators could look back to and say, okay, was what we heard addressed as the project continued. From there, we sort of switched to, what you consider your more traditional evaluation, where we were assessing, are things working? What effect is this having? How are people responding? And trying to pick their brains as we went along at, what they were liking most, what could help things improve going forward. So we used surveys, feedback surveys for some, events and sessions that were held. There were surveys done with the focus, the advisory group. So they did a mid-project survey and they did an end-of-project survey. And those were mostly outcomes focused, trying to assess what they had gained themselves through the project. We used focus groups quite a bit over the project. Again, at the start with newcomers. Then we sort of had a midpoint focus group with the advisory committee members as some of the project materials were being developed to sort of check in early on around, just to get their sense how things were looking, how they felt it was coming together, what maybe needed to change. And then there, I guess, as well as a method through the project, in addition to just data collection, project data collection, was some just observation. For example, when those interactive education sessions were pilot tested, for example, that we were there just observing engagement. And, to what extent newcomers were participating and listening and really engaging in the session. And same with the service provider session, to sort of see what kind of questions were coming up and, how they were involving themselves in the sessions. So I think, high level, to think about what was learned, I think we can say, absolutely, through the project, newcomers gained significant understanding around how mental health and mental wellness is approached here in Canada, as well as around practical resources and services that are available locally. We also know that service providers found the sessions really valuable in terms of understanding how they may need to adjust their services in some ways to better meet the needs of newcomers, but also to better take advantage of the strengths of newcomers and their resilience. In the 3 pilot groups we held where we tested that education and engagement session. So we did that with newcomer parents, again, youth, newcomers, and service providers. So in the case of the newcomers who participated in those sessions, 95% of them said that they found the session to be helpful. And most of those said it was extremely helpful. 95% of them, again, felt that those sessions would be helpful to other people in their newcomer community, so family members and friends. And again, 78% of them said extremely helpful, and 17% said, yeah, these are needed. And 100% of service providers actually reported that they gained understanding about the barriers that face newcomers around accessing mental health supports or services. And 83% identified learning in very specific areas that the sessions were targeting, aside from just barriers. The other thing we tried to do in those surveys was leave some space for some qualitative feedback. One comment that we heard was, I have a deeper understanding about what mental health is versus what is crazy. I understand that it's normal to have some mental health problems at different times in our life, and it's okay to say this. That was something we heard repeatedly, and early on we heard that stigma was a really big challenge for a lot of newcomers for all kinds of reasons. So later in the project, to be hearing some of this kind of feedback, that people, felt it was okay to talk about mental health, and that they wanted more newcomers to engage in these kinds of conversations, that they found them very beneficial. Interestingly, newcomer parents, several of them made comments like, it is so necessary to pay attention to this important topic. We got some really interesting comments from service providers who completed some of our feedback surveys. For example, one service provider said, I gained consideration of really important concepts that will help me to frame my work better with newcomers. And we heard things like, this session really helped me to understand the level of barriers and trauma that newcomers face in their journey to Canada, but also once they've settled here. I think for some service providers, clearly from the feedback they gave us, it really was an eye-opener to understand how common trauma is in the experience of many newcomers, particularly those who have gone through, who have had to flee their home because of violence.
I think this project could be replicated in bigger cities and smaller rural areas. The project would just have to be very cognizant of logistics, especially in the bigger cities, with regards to getting people together and, if the participants were spread out over a geographic area in a larger city. In a rural community, I think some of the challenges might be, again, anonymity and concern for confidentiality. Accessing services, being involved could carry some stigma in some of the newcomer communities, especially if they live in rural areas. So I think this definitely could be a challenge. But on the other hand, I also believe that smaller communities have there's a heart in the center of the community. So maybe those challenges would be met with, acceptance of it eventually if such a project were to be implemented. I really believe that this project could definitely be implemented very fully and very robustly in the school system, especially in the secondary system, grades 9 through 12, 14 to 19 age group definitely should also have some information and begin these conversations at that age because that's when we know that mental health challenges begin. The next phase of the project, which is being funded by the Royal Bank of Canada, the next phase is called My Journey of Hope. And that next phase is about delivering services with regards to a narrative form of therapy modality. It's really about talking about people's experiences and certainly telling their life stories and about their lived experiences with mental health and wellness, and or, you know, the challenges they've had as newcomers coming to Canada. One piece of advice I would like to give to community partners or other organizations that might like to implement a mental health and wellness program for newcomers and parents is that you have to be inclusive and you have to involve the newcomer youth and the parents in the project to the point where they're partners. It's very important that the partnership is there and the collaboration is there. You know, as mental health providers and as people who are coming from a different cultural context, we cannot have all the answers, and we really need to have newcomer youth and parents involved because they understand their communities best.